you're muted right now, so.
Okay, can he see us? I mean, I can't see his face on here.
He doesn't have his camera on yet, but he will.
Good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation again for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. We are fortunate to have tools like safe and effective vaccines that can offer us protection from COVID-19 during this pandemic, and we continue to urge Lancaster County residents to take advantage of them. More than 62% of us have come forward and are now vaccinated, which helps protect ourselves, our loved ones, and our community. And we need everyone else to do the same. Over the holiday weekend, you may have heard about a new variant emerging called Omicron. Right now, there are more questions than answers, and as we learn more in the coming weeks, we will share that with you. What we do know is the World Health Organization has designated it as a variant of concern. The variant is spreading rapidly in several other countries. Scientists in the U.S. and around the world are working quickly to learn more about vaccine effectiveness related to this variant. No cases have been identified in the U.S. as of now, but it is likely only a matter of time. Federal, state, and local health officials are closely monitoring this developing situation. What we also know is that COVID-19 vaccine offers the best protection against the virus, and this situation further stresses the importance of vaccination. If you're eligible for a first, second, or booster dose of vaccine, schedule an appointment at an upcoming clinic at covid19.lincoln.ne.gov or at local pharmacies, which are also offering the vaccine. Or go to vaccines.gov or text your zip code to 438829 to find one near you. Vaccination can also help prevent other new variants from emerging by reducing spread, which gives the virus less opportunities to mutate. Vaccination remains an essential tool to help reduce the impact of the virus on our hospitals and in our community. Within the last month, 5 to 11-year-olds were approved for Pfizer's COVID-19 vaccine, and booster doses were expanded to include all adults 18 years and older. We continue to focus on vaccinating 5 to 11-year-olds, and more than 23%, or just over 6,700, have been received a first dose, and more than 1,300 children in that age group are now fully vaccinated. We have several clinics offering first and second doses to choose to younger children this week. The CDC recommends booster doses for everyone 18 and older. If you received a second dose of Pfizer or Moderna vaccine at least 6 months ago, or a single dose of Johnson & Johnson vaccine at least 2 months ago, it's time for a booster, and we really urge you to get it done now so you have that extra layer of protection. Close to 60,000 Lancaster County residents have received a booster dose or a third dose. Joining us today is Dr. Jim Nora, who is an infectious disease specialist. He'll share some further information about COVID-19 vaccination, expanded booster doses, recommendations, and new treatments in the emerging variant. Dr. Nora?
Hi, this is Dr. Jim Nora. Are people able to hear me? Fantastic. I apologize. I've had some technical difficulties on the computer, and so I'm using my phone and a regular landline. But thank you for the invitation to speak today, and there are certainly a lot of questions that have come up about the new variant that has emerged, and a lot of new information about vaccines. And I just wanted to share some of the latest guidance on vaccines. So as most people are aware we have 3 different vaccines to combat COVID-19, and 2 of these are mRNA vaccines, and one is a adenovirus vector vaccine. That's the Johnson and Johnson, and the schedule with which these are given has changed significantly since the start of the pandemic. So currently, there is a recommendation for all vaccines to receive a booster. So if someone received the Johnson and Johnson vaccine initially, they should get a booster vaccine 2 months or after the initial dose, and that's for all individuals 18 and older. For people who received the Moderna vaccine initially, they should have received their second dose 4 weeks after the initial dose, and then the booster dose should be given 6 months after the second dose of the initial series. And that vaccine, that recommendation for a booster now applies to all individuals aged 18 and older. And then finally, the Pfizer vaccine, there is also a recommendation for a booster dose for all adults aged 18 and older, and that should be 6 months after the second dose. And for the Pfizer vaccine, we also are fortunate now to have the ability to offer that to children between the ages of 5 and 11, and also the group 12 to 17. And we may see some expansion of offerings from the other vaccines into the childhood ages as well. So this is by far the most important tool we have to combat COVID-19. And I can tell you, I'm working in the hospital today. The hospital is absolutely packed. Walking through the ER, we have patients that are basically in the hallways, waiting to be admitted, waiting to be seen. There's just no extra room in the hospitals, not only here in Lincoln, but in Omaha as well. So we implore people to do whatever you can to avoid being hospitalized, and getting vaccinated is the best way to do that. I would also put in a word for getting the influenza vaccine. We are seeing some cases of influenza around the country, and in some parts even high rates of transmission. It looks like the H3N2 variant of influenza is going to be more common this year. At least there's some preliminary data to suggest that, and this is a particularly difficult strain of influenza because it can lead to increased risks of hospitalization, greater risk of secondary bacterial pneumonia. So all things that could land people in the hospital, and we absolutely have no extra space. The hospital will do everything they can to accommodate everyone who needs to be admitted, but anything we can do to prevent people from getting admitted to the hospital is what we want to at least strongly encourage. So those are some points. I guess I wanted to make one comment about some of the medications that people may be hearing about. There is an antiviral medication called molnupiravir that the FDA is meeting today as we speak to potentially offer an EUA. This is an antiviral medication that can be taken by mouth at the first signs of COVID infection. So it's an exciting new addition to our treatment options. However, the efficacy is not nearly as good as vaccination. The initial data suggested there was a 50% efficacy rate, and that has since dropped to 30% from the most recent data I've heard. So I will have to wait and see what the final report is. It will likely be approved from what I've heard, and we'll gladly accept this tool in our tool chest, but it is not as good as the vaccine. There is also a new monoclonal antibody that is going to be discussed by the FDA in the next couple of weeks, and it will be the first pre-exposure prophylaxis treatment, and it will offer those that have weakened immune systems that do not necessarily respond to the vaccines an option for getting some protection, some passive immunity to protect against COVID-19, and that may last for up to 6 months. So we'll have to see what the final EUA is on that. So those are some of the comments I had. I would certainly be happy to answer any questions that I may.
Well, thank you, Dr. Nora, for joining us today and providing valuable information. We so appreciate the physicians sharing information and taking time when they're trying to take care of patients. Next, let's go over the most recent data related to our local situation. The COVID-19 case positivity rate and hospitalizations are remaining too high, as Dr. Nora mentioned. Because of the COVID-19 risk dial staying in the mid-orange today, meaning the risk of COVID-19 spread and impact in the community is high. We have experienced a steady increase in cases since October 25th. On the chart, you can see the 7-day rolling average increase from 80 cases a day to an average of 134 cases on November 19th. We did see a drop in cases toward the end of last week, but we believe much of this was due to the limited testing options over the long holiday weekend. The positivity rate has also declined from 13.6% to 12.4% for the week ending November 27. The highest number of new cases over the past several weeks have resulted in more people with COVID-19 seeking medical care and being admitted to our hospitals. The 7-day rolling average of COVID-19 patients hospitalized locally demonstrates this high daily average, up to 98 patients on November 18th and 94 patients at the end of last week, November 27th. Today, Bryan Health and CHI St. Elizabeth reported 108 COVID-19 patients hospitalized. 62 of those patients are from Lancaster County. We all need to continue to do our part to help alleviate stress on our healthcare system. Local hospital capacity continues to be very concerning. We have one death to report today, a man in his 40s. So far in November, 16 people have died from COVID-19. With every death, a family loses a loved one, and we lose another member of our community. And sadly, we've lost too many people to the virus. However, I also want to share collectively how our public health department has worked with the community to reduce the number of lives lost. This chart shows a comparison of the number of COVID-19 deaths per 100,000 population. As you can see on the left, Lancaster County is much lower at 102 deaths per 100,000 residents, compared to Douglas County at 150, lower than the state at 161, and much lower than the other 91 Nebraska counties combined at 185. This shows that Lancaster County has fared better than the rest of the state during the pandemic. This is significant because the ultimate goal has been to save lives. This helps put in perspective. If Lancaster County had higher rates of death, as in other states and communities, the impacts would be much worse. This chart that you're looking at now shows the number of additional deaths we would have had in Lancaster County. If Lancaster County had the same rate as Douglas County, we would have had an additional 154 deaths. If we had the same rate as the state, we would have had an additional 189 deaths. Compared to Kansas, we would have lost another 404 community members. And compared to Iowa, we would have had an additional 417 community members lost. Compared to South Dakota, we would have lost an additional 507 community members. And if we had the same rate as the state of Mississippi, which has the highest rate in the country at 344 deaths per 100,000 population, we would have an additional 771 deaths. There are many factors influencing the results in Lancaster County, including stronger directed health measures, business commitment to safety protocols, our mask mandate, and the public's commitment to do their part to protect one another. Together, we will continue to face the challenge posed by the virus that has proved to be unpredictable. Scientists and public health officials are working quickly and thoroughly to further understand the new variant, and we don't yet know what the impact will be on us. The winter months and the holidays are upon us, where more people spend time indoors and gather together. So we now have a window of opportunity for children ages 5 to 11 to be fully vaccinated against COVID-19, for adults 18 and older to receive their booster doses, and for others to get vaccinated if they haven't already. This will enable us to build stronger protection against the virus as individuals and as a community, and to better position us for what may come in the weeks and months ahead. We will continue to actively monitor the developments related to the new variant, and we will share more information as it becomes available. The two most important actions we can take in the meantime are getting our COVID-19 vaccine, our booster, and wearing a mask. You can also track our local situation daily on the COVID-19 dashboard. We also issue COVID-19 updates every weekday that include the latest data and information. These are all posted at covid19.lincoln.ne.gov. Click on the News Releases button on the top of the left of the page. You can also find updates on the city's landing page at lincoln.ne.gov in the latest news section. And if you use social media, you can also follow the City of Lincoln and Lincoln-Lancaster County Health Department on Twitter and Facebook. And if you have COVID-19 questions or are seeking general information and resources, the hotline is available Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we'll take any questions.
Hi, this is Bailey Bishop with 1011. I was wondering, do you have any numbers that show how many new adults 18 and over have initiated the process of getting the vaccine?
The new one's 18 and over. I don't have that, Bailey, but I can get it to you.
This is Bailey again. I believe that it was discussed in the last press conference that there was an intention to let the mask mandate expire at the end of the month, giving people, one more month to get these things done that they need to. Why would they make that decision to let it expire if the numbers are showing that is working to reduce deaths?
Well, Bailey, I think we're continuously looking at the community situation, and if the thought is everyone has an opportunity to take action and protect themselves and protect our community, so we're really calling everyone to action to do that. And as I said at the briefing, we're going to continuously monitor. Now we have another new variant of concern. So we can talk about what our plan is, but we'll be monitoring where we are and make a final decision when we get to that point based on the current data.
And then what was the percentage of kids 5 to 11 vaccinated? Again, I just missed that number.
It's 23%. 4.7% of that age group that are fully vaccinated. They started receiving their second doses yesterday, and that'll continue throughout this weekend.
When you see the numbers that show that Lancaster County is having fewer deaths, just how does that make you feel as our health director who's been leading the charge of combating this virus for nearly 2 years?
Well, that makes me feel that we've been successful in doing what we've tried to do, and it's been a while since we shared the death data, but this is something that we continuously monitor and have monitored throughout the pandemic. And I think it's just really important for people to see, the purpose of doing these measures is to prevent death, and that's what we've done. So it reinforces that we're listening to the data and taking the right measures.
And then you said our positivity rate dropped to 12-ish percent, 12.4%. Do you believe that decrease is because of the reduced testing over Thanksgiving, or do you think that's just going down?
It could partially be due to that, but our cases, in looking at our number of cases, I think that's made a difference. I think we'll have a better idea towards, as this week goes forward, towards next week. Any other questions today? All right. Thank you again for joining us today, and be sure to get vaccinated if you haven't, get your booster and wear your mask. Thank you.